Myocarditis is a medical condition characterized by inflammation of the myocardium, which is the muscular tissue of the heart. It typically results from an infection or an immune response, although it can also be caused by certain medications, toxins, or other diseases. When myocarditis occurs, the heart muscle becomes inflamed and can weaken, affecting the heart's ability to pump blood efficiently. The inflammation can also lead to damage of the heart muscle cells. Myocarditis can be acute, meaning it occurs suddenly and lasts for a short duration, or it can be chronic, where the inflammation persists for a longer period. Diagnosing myocarditis involves a combination of medical history assessment, physical examination, blood tests to check for markers of inflammation, and imaging tests like electrocardiogram, ECG, echocardiogram, or cardiac MRI. In some cases, a biopsy of the heart muscle may be necessary to confirm the diagnosis. The symptoms of myocarditis can vary in severity and may resemble those of other heart conditions. Some common symptoms of myocarditis include chest pain. This can range from a mild discomfort to severe chest pain similar to a heart attack. The pain may be sharp, stabbing, or aching and can be located in the center of the chest or spread to the neck, back, or arms. Fatigue. Feeling excessively tired or experiencing a lack of energy is a common symptom of myocarditis. This fatigue may occur even with minimal physical exertion or at rest. Shortness of breath. Difficulty breathing or breathlessness, especially during physical activity or when lying flat, is a typical symptom. It may be accompanied by a rapid or irregular heartbeat. Rapid or irregular heartbeat. Myocarditis can cause abnormalities in heart rhythm, leading to a rapid or irregular heartbeat, also known as palpitations. You may feel like your heart is racing, skipping beats, or fluttering. Swelling. Some individuals with myocarditis may develop swelling in the legs, ankles, feet, or abdomen due to fluid retention, which can be a sign of heart failure. Flu-like symptoms. Myocarditis may be preceded or accompanied by symptoms similar to the flu, such as fever, body aches, joint pain, sore throat, headache, or general malaise. Myocarditis can have various causes, including viral infections. The most common cause of myocarditis is viral infections. Viruses such as the Coxsackie virus, adenovirus, parvovirus B19, and human herpes virus can infect the heart muscle and trigger an inflammatory response. Bacterial, fungal, and parasitic infections. In addition to viruses, bacteria, fungi, and parasites can also infect the heart muscle and lead to myocarditis. Examples include Lyme disease, caused by Borrelia burgdorferi, Chagas disease, caused by Trypanosoma cruzi, and certain bacterial infections like diphtheria. Autoimmune disorders. Some autoimmune conditions can cause the body's immune system to mistakenly attack the heart muscle, leading to inflammation. Autoimmune disorders associated with myocarditis include systemic lupus erythematosus, rheumatoid arthritis, and giant cell myocarditis. Medications and toxins. Certain medications and toxins can cause myocarditis as a side effect. For instance, some chemotherapy drugs, certain antibiotics, and drugs used to treat autoimmune conditions have been associated with myocarditis. Exposure to certain toxins, such as heavy metals or cocaine, can also contribute to the development of myocarditis. Allergic reactions. Rarely, severe allergic reactions, particularly to medications, can trigger an immune response that affects the heart muscle and causes myocarditis. Systemic diseases. Certain systemic diseases, such as sarcoidosis, a condition characterized by the formation of granulomas in various organs, or amyloidosis, deposition of abnormal proteins, can involve the heart and lead to myocarditis. The treatment for myocarditis aims to manage the underlying cause, alleviate symptoms, prevent complications, and support the heart's function. The specific treatment approach may vary depending on the severity of the myocarditis and the individual's overall health. Here are some common treatment options. Rest and activity restriction. In mild cases of myocarditis, doctors may recommend rest and restricting physical activity to allow the heart to heal and reduce the workload on the heart. Medications. The use of medications may be prescribed to manage symptoms, reduce inflammation, and support heart function. These may include nonsteroidal anti-inflammatory drugs, NSAIDs. These can help relieve pain and reduce inflammation. Corticosteroids. In cases of severe inflammation, corticosteroids may be prescribed to reduce immune system activity and inflammation in the heart. Diuretics. These medications help eliminate excess fluid from the body and can be used to manage fluid retention and swelling. Medications for heart failure. If myocarditis leads to heart failure, medications such as beta blockers, ACE inhibitors, or angiotensin receptor blockers, ARBs, may be prescribed to manage heart function and symptoms. Treatment of underlying infections or autoimmune conditions. If an infection or autoimmune condition is identified as the cause of myocarditis, specific treatments targeted at the underlying condition will be initiated. This may involve antiviral medications, antibiotics, antifungal drugs, immunosuppressive medications, or other targeted therapies. Supportive care. In severe cases of myocarditis or when complications such as heart failure occur, hospitalization may be necessary. Supportive care may include intravenous fluids, medications to improve heart function, oxygen therapy, and close monitoring of vital signs. Cardiac devices or procedures. In certain cases, advanced heart failure or life-threatening arrhythmias may require the use of cardiac devices such as implantable cardioverter defibrillators, ICDs, or ventricular assist devices, VADs. In rare cases, heart transplantation may be considered for individuals with severe heart damage and irreversible symptoms.